Hello, everyone. My name is Corsair Mack, and I'm the owner and clinician at Max Empowerment Counseling, LLC. Today, we are going to go over some 2021 trends of mental health that are going into 2022. So, we are going to take a look at the website mhanational.org. They've pulled data from a bunch of different sites and a bunch of different mental health places to give us what's been really going on in 2021 going into 2022. So we're going to take a look at that today. So sit back, relax, do your own research, take everything I say with a grain of salt, and enjoy the video. All right, here we are at mentalhealthamericanational.org, and we are going to see the state of mental health in America. So let's take a look. All right, so they have statistics for 2022, 2021, and 2020. All right, here we're going to go into the key findings. I'm going to go into a more in-depth look. 2022 key findings. All right, in 2019, just prior to the COVID-19 pandemic, 19.86% of adults experienced a mental health illness, equivalent to nearly 50 million Americans. Suicidal ideation continues to increase among adults in the U.S. 4.58% of adults report having serious thoughts of suicide, an increase of 664,000 people from last year's data set. The national rate of suicidal ideation among adults has increased every year since 2011-2012. This was a large increase that's seen in last year's report and is a concerning trend to see going into the COVID-19 pandemic. Growing percentage of youth in the United States live with major depression. 15.08% of youth experience a major depressive episode in the past year, a 1.24% increase from last year's data set. In the bottom ranked states, up to 19% of youth ages 12 through 17 experience major depression. Over 2.5 million youth in the United States have severe depression, and multiracial youth are at greatest risk. 10.6% of youth in the United States have severe major depression that severely affects functioning. The rate of severe depression was highest among youth who identified as more than one race, at 14.5%, more than one in every 7 multiracial youth. Over half of adults with a mental illness do not receive treatment, totaling over 27 million adults in the United States who are going untreated. In Hawaii, the bottom ranked state, 67% of adults with a mental illness did not receive treatment. Even in Vermont, the top ranked state in the United States, 43% of adults experience a mental illness were not receiving treatment. The percentage of adults with a mental illness who report unmet needs for treatment has increased every year since 2011. In 2019, 24.7% of adults with a mental illness report an unmet need for treatment. Over 60% of youth with major depression do not receive any mental health treatment. Even in states with the greatest access, nearly 1 in 3 are going without treatment. In Texas, the bottom ranked state for this indicator, nearly 3/4 of youth with depression did not receive mental health treatment. Nationally, fewer than 1 in 3 youth with severe depression receive consistent mental health care. Even among youth with severe depression who receive some treatment, only 27% receive consistent care. In Tennessee, the bottom ranked state, that rate is as low as 12%. 65.6% of youth in Maine, ranked number 1, receive consistent treatment, which is 16% higher than Vermont, which is at 49.7%, which is ranked number 2. Both adults and youth in the United States continue to lack adequate insurance coverage. 11.1% of Americans with a mental illness are uninsured. There was a 0.3% increase from last year's data set. The second year in a row, this indicator increased since the passage of the Affordable Care Act. 8.1% of children had private insurance that did not cover mental health services, totaling 950,000 youth. Rates of substance use are increased for youth and adults. Even prior to the COVID 19 pandemic, 7.74% of U.S. adults and 4.08% of youth had a substance use disorder in the past year. Substance use increased 0.07 for adults and 0.25 for youth over the last year's report. All right, so now that we got through that, let me go ahead and do my reactions. All right, so going back to the first bullet point, in 2019, just prior to the COVID-19 pandemic, 19.86% of adults experienced a mental illness. That's equivalent to nearly 50 million Americans. That does make sense because ultimately, I don't know if this includes incarcerated people or people in hospitals or a homeless population, but that makes sense because, especially prior to the pandemic and even after the pandemic, mental health has been on the rise. Right? Normally, what we see, and then I'm just speaking from professional experience, a lot of people usually cover up their mental illness with either work or practically anything else, right? They do their best to blanket that and distract themselves from whatever's going on with something that helps them take their mind off things. That could be work, that could be school, that could be children, that could be a lot of different things. So it's going to be interesting to see how much that went up in 2022. And then for the second point, suicidal ideation continues to increase among adults in the US, right? That does make sense, especially after the COVID 19 pandemic, right? In my prior videos, I talk about the two factors that lead to suicide, not the end all be all factors, of course, but main factors being hopelessness and worthlessness. Well, now with the pandemic happening, a lot of Americans losing their job, a lot of Americans being kicked out, going on the streets, not be able to provide for their family, right, and really not seeing an end in sight, despite everything that's going on. There is a lot of, again, hopelessness and worthlessness going on. And even with jobs coming back, pay raises going to $15 an hour and things like that, right, we really take a look to see what areas is that really viable in regards to wherever people are living, right? Is $15 enough to live, or is it still not enough to live? And then again, that also goes into play where, around the United States, who is increasing their pay to $15 an hour, who is not. So that's going to be interesting to see as well. So yeah, the second point makes sense. Growing percentage of youth in the U.S. live with major depression, right? That makes sense to me. Even before the pandemic, you have a lot of different things that youth are going through. And now, during the pandemic, right, add on the not be able to go to school, having to figure out how to do things online and things like that, not be able to get in contact with their friends. See, as human beings, we are social creatures. We thrive off of that social factor, some more than others, of course. But yeah, we need that social interaction, that social contact. And now that we're being deprived of that social contact or not really looking to take other avenues to get that social contact, it makes sense why our youth are living with major depression. All right, and then over 2 oh, actually, and going with that also, we tend to get that a lot from our parents as well. If our parents are experiencing depression and we live with them, we're seeing the hardness and the hardships that they're going through and things like that. Right, that really does make sense why youth are also experiencing major depression, and that's increasing. All right, and the next point, over 2.5 million youth in the U.S. have severe depression, and multiracial youth are at greatest risk. Right, I could see that, and that definitely does make sense to me because, as we know here in America, if you are interracial, if you are black or a person of color, Hispanic, Asian, Middle Eastern, so on and so forth, you have a higher chance of not having access to healthcare or mental health treatment, especially with things that are going on in the insurance system. Some insurances are better than others in this regards, though depending on the insurance that you have, you will have a harder time of accessing mental health, right? Whether it's you need to be in an inpatient setting or hospitalization to have insurance cover it, or insurance will say, okay, you have 5 sessions covered, and after that, you're on your own. You know, again, that makes sense to me. All right, over half of adults with a mental illness do not receive treatment, totaling over 27 million adults in the US who are going untreated. Again, I want to see how much this goes into with incarcerated individuals or the homeless population. But like I mentioned in my prior statement, this makes sense depending on the insurance you have. You have limits to mental health care coverage. All right, so the percentage of adults with a mental illness who report unmet needs for treatment has increased every year since 2011. Again, makes sense to me. Now that we are becoming more mindful of things that are happening, now that we're becoming more open with our mental health, a lot more people are coming forward and saying, hey, I have this issue and I'm not receiving help for it, right? And also, I know a lot of employers, again, this doesn't mean every employer, but a lot of employers are really taking notice of that. And some are helping, some aren't. And, this could cause and also exacerbate that in a sense of people aren't receiving the care that they need, even if they do have insurance. So that makes sense to me also. All right, so over 60% of youth with major depression do not receive any mental health treatment. And again, that makes sense to me, and I believe a lot of it has to do, not all of it, a lot of it though has to do with the parents, right? Whether they believe this goes back against the stigma of mental health, whether they believe mental health is real, whether they just need to suck it up, whether they just need to get put on medication and not have that talk therapy to really work through their issues and things like that. But yeah, like I said, that makes sense to me. And then nationally, fewer than 1 in 3 youth with severe depression receive consistent mental health care. Again, with the reasons I stated above, as well as with bullying from their peers and anything else like that, right? That makes sense. Nationally, fewer than 1 in 3 youth with severe depression receive consistent mental health care. Okay, yeah, I already said that, so I apologize. So both adults and youth in the U.S. continue to lack adequate insurance coverage. Again, that just goes back to a prior thing that I stated. It depends on the insurance that you have, right? Some, like I mentioned earlier, you can get covered if you have been hospitalized or you're in inpatient care, or even sometimes partial IOP, but those are rare depending on your insurance coverage. Then also others have limits saying, okay, you can have 1 in 5 covered for the year, or 1 or 2 sessions a month. Again, that's really lucky, but again, that depends on your insurance provider. So yep, like I said, that makes sense also. And then lastly, rate of substance use are increasing for youth and adults even prior to the COVID-19 pandemic. Right, that makes sense. Prior to COVID-19 and even with COVID-19, things have not been easy for people. And a great release or a great escape that people go to are substances, right? And like I mentioned, I wonder if this contains the homeless population or even individuals who are incarcerated, because ultimately life for them is not easy. For the homeless population, you have a lot of things going against you here in the United States, depending on where you live. Whether that's, if you live in a homeless shelter, you have to be back by a certain time, which doesn't give a lot of wiggle room if you're trying to work yourself out of that situation. And in shelters, depending on where you live, you'll have your stuff stolen, you have mistreatment, you have, a lot of things working for you, especially if you're a female or a child. So, again, that makes sense to me. The feelings of substances are a lot better than your reality. And that's what a lot of people who are homeless, or even people who come out of jail, go to. And then that causes recidivism and things like that also. I can go more in depth in that, but that makes sense. That makes sense to me. All right, so, and this looks like everything that we've read. Yep, everything that we've read. Okay, so that makes sense. All right, so this next part. This year's report includes spotlights on 2 of MHA's policy priorities in 2021-2022, the implementation of 9 988 as the national three-digit suicide prevention and mental health crisis hotline, and increasing mental health education and supports in schools, particularly for BIPOC, which stands for Black, Indigenous, People of Color Youth. All right, the suicidal ideation and 988 implementation with the passage of the new 988 number for suicide prevention and mental health crises, there is an opportunity to create a continuum of care with adequate funding that ensures mental health responses to mental health crises and prioritizes equity, particularly for BIPOC individuals. However, of the 13 states ranked 39 through 51 with the highest rates of suicidal ideation among adults, only 4 have successfully passed state legislation for 988 implementation: Utah, Oregon, Indiana, and Colorado. Of these, only one currently includes user fees. Oh, wow. Only one includes user fees. That sucks because ultimately, a lot of people who are feeling suicidal, not everyone, but a lot of people who are feeling suicidal feel like they're a burden. And if they get this extra thing on top of that, that would deter them from getting help. So that is unfortunate. Though I believe here in Illinois, we did pass the 988 number, which makes it a lot easier to get help. Because if you're going through a crisis or if you are feeling suicidal, dialing or even texting 988 instead of dialing the 10-digit number is a lot easier and is a lot better. And when you're in a crisis, you want things to be as easy as possible to help you get through that situation. So I'm really happy that they went through with 988. I believe in Illinois we did go through the 988. All right, so disparities in mental health treatment for youth of color. White youth with depression were most likely to receive mental health treatment, and Asian youth were least likely to receive mental health care. Youth of color with depression, particularly Native American or American Indian, multiracial, and Black youth were most likely to receive non-specialty mental health services in educational settings. To create healthier communities and to better serve students of color who may only receive mental health services in educational settings, schools need long-term financial support to build up, sustain, and sufficient school infrastructure. And this makes sense to me, right? I won't go on my tangent or rant about that. Though, am I saying white youth with depression do not deserve mental health treatment? No, they 100% do. Anybody and everybody deserves mental health treatment, right? We just want to make sure it's accessible across the board, right? Because ultimately we're seeing more positive things in regards to youth getting mental health treatment, right? They're better set themselves up to process things that they've gone through in their youth, process toxic patterns that they learned from their parents, and better able to better manage and care for their mental health and their emotions and their feelings and things like that. And again, like I mentioned earlier, right, if you're multiracial, Black, Hispanic, Asian, or things like that, right, you are less likely to have access to mental health treatment. And one thing, especially when it comes to the Asian youth who are less likely to receive mental health care, it comes with basically culture, right? More in Eastern cultures, there is a lot to do with collectivism as opposed to individuality, which you'll see more in Western cultures, right? And with that collective groupthink in that sense, you really do not go outside to address any mental health issues, right? You keep that inside the family and even in some instances, close friends. With that, you know, you talk it over with family and close friends and, you know, you get your advice from them, right? Not really processing through your mental health issues, not really getting the proper treatment that's needed. And ultimately, right, and even this goes in with African American or Black Americans here in the United States as well that still believe in going to the church, right? Going to the barber shop, right? Going to your friends, right? And then sometimes churches, barbershops, and friends, they don't give the best advice, right? Whether it is to suck it up, whether it is to just pray about it and let God deal with it, or whether it is to basically say, hey, you're this, you're that, you just have to deal with it, right? So ultimately, true, there's a lot of barriers that come with mental health treatment for people of color. Right, and I could speak on to this for hours if I needed to, but ultimately that makes sense to me. All right, we're going down. All right, so in the above links, you'll find collection data across all 50 states and District of Columbia answering the following questions. How many adults and youth have mental health issues? How many adults and youth have substance use issues? How many adults and youth have access to insurance? How many adults and youth have access to adequate insurances? How many adults and youth have access to mental health care? Which states have higher barriers to access mental health care? Okay, so that'll be interesting. So in the 2022 um, links up there, that's what we'll take a look at. And I'll scroll up here so that way you guys can pause and take a look at that. Or again, you can go to mhanational.org to take a look at this as well. All right. All right. So again, our goal to provide a snapshot of mental health status among youth and adults for policy and program analysis and evaluation to track changes in prevention of mental health issues and access to mental health care, to understand how changes in national data reflect the impact of legislation and policies, and to increase dialogue and improve outcomes for individuals and families with mental health needs. Why gather the information? Using national survey data allows us to measure a community's mental health needs, access to care, and outcomes regardless of the differences between the states and their varied mental health policies. Rankings explore which states are more effective at addressing issues related to mental health and substance use. Analysis may reveal similarities and differences among states in order to begin accessing how federal and state mental health policies result in more or less access to care. All right, so let's go to the 2022 data. All right, so here we go, ranking guidelines. All right, so the following information provides guidelines about one, how we choose our data, two, how we rank our data, and three, important information about the national survey where we acquired and analyzed our data. All right, this data and accompanying chart book present a collection of data that provides a baseline for answering some questions about how many people in America need to have access to mental health services. The data and table include state and national data and shareable information. Alrighty, yeah, I think we talked about this. Alrighty, the MHA guidelines. We're going to go down to our 2022 measures. I'll leave that up here if you guys want to read that. But our 2022 measures, all right, and I guess that goes to what's over here. Adults with any mental illness, AMI, adults with substance use disorder in the past year, adults with serious thoughts of suicide, youth with at least one major depressive episode in the past year, youth with substance use disorder in the past year, youth with severe major depressive episode, adults with AMI who did not receive treatment, adults with AMI reporting unmet needs, adults with AMI who are uninsured, adults with disability who cannot see a doctor due to costs, youth with MDE who did not receive mental health services, youth with severe MDE who received some consistent treatment, children with private insurance that did not cover mental or emotional problems, students identified with emotional disturbance for an individualized education program, and mental health workforce availability. All right, a complete picture. All right, with the above 50 measures are not a complete picture of the mental health system. They do provide a strong foundation for understanding the prevalence of mental concerns, as well as issues of access to insurances and treatment, particularly as that access varies among states. MHA will continue to explore new measures that allow us more accurate and comprehensively capture the needs of those with mental illness and their access to care. All right, so of course this goes into ranking. To better understand ranking, it is important to compare similar states. All right, so of course factors considered include geography size. For example, one state's bigger than the other, so one population size will be bigger than the other. Yeah, basically that's what that says. right? The rankings are based on the percentages or rates for each state collected from the most recent available data. For most indicators, the data represents data collected up to 2019. States with positive outcomes are ranked higher, closer to one. States with poor than states with poor outcomes. Okay, so the higher the ranking, the more positive the outcome. Alrighty. The overall adult youth prevalence and access rankings were analyzed by calculating a standardized score, Z score, of course, for each measure, ranking sum of standardized scores. For most measures, lower percentages equate to more positive outcomes. All right, so yeah, that gives that. All right. All right, here we go. This is the students identified with emotional disturbance for individual education program. Okay, I'll also just explain what those are. Okay. All right, so I'm just reading over this real quick to see if there's anything important to mention. And then, of course, you guys can pause it to read the full thing. You can go to the website as well. Okay, these measures adult with disabilities who could not see a doctor due to costs was previously calculated using the behavioral risk factor surveillance system. Question: are you limited in any way in any activities because of physical, mental, or emotional problems? All right, the complicated acronym questions was removed from the BRFSS questionnaire after 2016 and therefore cannot be calculated using 2019 data. Okay. All right. Interesting. All right. Survey limitations. All right. All right. Of course, each survey has its own strengths and limitations. For example, strength of both SAMHSA National Survey of Drug Use and Health and the CDC Behavioral Risk Factor Surveillance System are that they include national survey data with a large sample size and utilize statistical modeling to provide weighted estimates of each state population. All right, this means that the data is more representative of the general population. Okay. Okay, so general population. An example limitation of particular importance in the mental health community is that the NSDUH does not collect information for persons who are experiencing homelessness. Okay, here we go. And who do not stay at shelters are active duty military personnel or are institutionalized, i.e., jails or hospitals. Okay, so this does not include that, which would be interesting to see how the data would sway or shift if it included those, if they were able to gather that information. So that's interesting to note, and I'm glad that they put that there. Okay. If the data did include individuals who are experiencing homeless and or incarcerated, we would possibly see prevalence of behavioral health issues increase and access to treatment rates worsen, which makes sense, right? Because like I experienced a lot of this when I was doing therapy in my prior place of employment, when I was doing inpatient, or even when I was at the jails during my internship. They do not have access, or a lot of them, I'll say a vast majority, did not have access to mental health care, right? Whether they're homeless or incarcerated, right? They did not have access to care, which is interesting. I know some places are doing their best to help with that, but of course, that's not across the board. Those are far and few in between. So, yeah, that would be interesting to see how the data would sway if we included those things as well. And that's interesting. They also mention active duty personnel or people who are deployed overseas. I am assuming, again, this is just my guesstimation, they do not have basically access to mental health care overseas. I don't know if they train counselors and send them over. Something interesting to think about. That is interesting. I'm really glad they included that there. Okay, so I will let you guys pause it to read the rest of this. I really want to go into the data because this sounds interesting. All right, so let's scroll back up to 2022. And let's take a look at ranking the states, see where that takes us. All right, so they have, of course, adult ranks and youth ranks. All right, so adult ranking 2022. All right, so states that are ranked 1 to 10 have a lower prevalence of mental illness and higher rates of access to care for adults. States that are ranked 39 to 51 indicate that adults have higher prevalence of mental illness and lower rates of access to care. And of course, we have the 7 measures. All right, so let's take a look at that. And I guess we can go to view all data too. Let's take a look to see New Jersey, Wisconsin, Massachusetts, Connecticut, New York, Minneapolis, Hawaii, Pennsylvania, Maryland, Illinois. We're number 10. Woo. All right, Rhode Island, South Dakota, and Kentucky. All right, so we are number 10. Fortunately, we're not number 1. That is good, but of course, we have some ways to go, and I'm really interested to see the numbers on that. All right, so then again, 39 to 51. All right, 39 starting at Idaho, Nevada, Mississippi, Kansas, Indiana, Missouri, District of Columbia, Alaska, Alabama, Utah, Oregon, Wyoming, and Colorado. All right. All right, so let's go to youth ranking 2022. Oh, that's cool. You can do that. Let's see, we're ranked number 12. All right, one away from 13, which is not good, but at least we're in the top 13, which is good. But still, we have ways to go. All right, again, same thing. All right, so top 13 for youth. Pennsylvania, Maine, District of Columbia, Vermont, Massachusetts, New Hampshire, New Jersey, Connecticut, New York, Maryland, Wisconsin, Illinois, and Colorado. All right, and then 39 to 51. Washington, Tennessee, Texas, North Carolina, Wyoming, West Virginia, Oregon, Alaska, New Mexico, Arkansas, Arizona, Idaho, and Nevada. All right. Prevalence of mental illness in 2022. All right, let's just go back up here and let's just do all the data. Okay, here we go. Prevalence of mental illness 2022. All right, going into 2022. All right, so we got, of course, we got that. We took a look at already. And then we're at number 16. Wait. Okay, so prevalence data, 6 measures make up prevalence include adults with any mental illness. Okay, yeah, so we took a look at that. And then we are number 16. So we're not even in the top 13 for this one. Oh, wow. Ugh. All right. So number 1's New Jersey, number 2's Florida, number 3's Georgia, number 4's Texas, number 5's New York, number 6 Pennsylvania, number 7's Mississippi. All right. Well, still we're 16, so that's not good. Okay. All right. So adult prevalence of mental illness going into 2022. All right. So 19.8% of adults are experiencing a mental illness, again equivalent to nearly 50 million Americans, like what we read before. 4.91% experience severe mental illness. The state prevalence of adult mental illness ranges from 16.37 in New Jersey to 26.86 in Utah. According to SAMHSA, any mental illness is defined as having a diagnosable mental, behavioral, or emotional disorder other than a developmental or substance use disorder. Any mental illness includes persons who have mild mental illness, moderate mental illness, and serious mental illness. All right, so here we go. Again, where is Illinois? All right, we're number 11, 19.18%, or 1,858,000 Americans that live in Illinois have prevalent. Wow. Okay. Wow. That is interesting. All right, and then what I will do. All right, so the top 13, which is where we want to be. New Jersey, Texas, Florida, Hawaii, Maryland, Georgia, South Dakota, Iowa, Virginia, Connecticut, Illinois, North Carolina, Tennessee. All right, cool. And then the bottom 36 to 52. Vermont, Indiana, New Hampshire, Rhode Island, Idaho, Oklahoma, Kentucky, Wyoming, Missouri, District of Columbia, Colorado, Washington, Ohio, Oregon, West Virginia, Utah, and then the national being almost 50 million Americans. All right, so I will do that so that way everybody else can see their state. All right, let's go to the next one. Excuse me. All right, adults with substance use disorder. All right, I guess we can go here and see where we're at. We're ranked 31. Holy crap. Okay. So 7.74 of adults in America reported having substance use disorder the past year. 2.97% of adults in America report having an illicit drug use disorder in the past year. 5.71% of adults in America report having an alcohol use disorder in the past year. All right, the state prevalence of adults with substance use disorder ranges from 5.98 in Florida to 12.30 in the District of Columbia. All right, so the top 13 where we want to be, we are not at. So percentage of adults with substance use disorders in their state: Florida with 5.98, West Virginia with 6.29, Texas with 6.48, Utah with 6.56, Georgia with 6.60, New Jersey with 6.71, South Carolina 6.73, Maryland with 7.01, Arizona with 7.11, Mississippi with 7.15, Arkansas with 7.16, Tennessee with 7.22, North Carolina 7.26, and then we are in Illinois 31 with 8.02, or 777,000 Americans living in Illinois have a substance use disorder or a substance use problem. All right, and then, of course, if you want to see where your state is, I'll pause it there for a second so you can take a look. And then, of course, the bottom 36 through 52. Hawaii 8.45, Washington 8.62, Delaware 8.79, Massachusetts 8.83, New Hampshire 8.84, North Dakota 8.88, Maine 8.89, Rhode Island 8.95, California 9.23, Nevada 9.32, Oregon 9.78, Montana 10.04, Vermont 10.10, Alaska 10.23, Colorado 11.75, District of Columbia 12.30. And then the average, with all it combined, all right. All right, adults with serious thoughts of suicide. All right, so where do we rank? We are number 5. All right, that's good. Not the best, but that is good. All right, so the percentage of adults reporting serious thoughts of suicide is 4.58. The estimate number of adults with serious suicidal thoughts is over 11.4 million, an increase of 664,000 people from last year's set, like what we read before. The national rate of adults experiencing suicidal ideation has increased every year since 2011-2012. The state prevalence of adults with serious thoughts of suicide ranges from 3.79 in New Jersey to 6.19 in Utah. All right, so we are number 5 at 4%, which is 388,000. Wow. Americans living in Illinois have suicidal ideation or serious thoughts of suicide. That is sad to hear. That is really sad to hear. But it makes sense. Like I mentioned, with everything that's been going on with the pandemic, people getting laid off, not making enough to live off of, feeling like they're not able to provide, again, like I mentioned, those feelings of hopelessness and worthlessness. So, wow. It's really sad to think about. All right, but let's go down to rank the top 13. New Jersey with 3.79, Georgia with 3.85, Texas with 3.86, North Carolina with 3.87, Illinois with 4, Florida 4.4, New York 4.21, Virginia 4.22, Maryland 4.34, District of Columbia 4.43, Connecticut 4.46, California 4.55, and Oklahoma 4.58. So those are the top 13 where you want to be. And again, I'll leave this here for a second so that way everybody can see their other states. Alrighty, and then let's go down to number 39, which is North Dakota. All right, so North Dakota 5.28, Idaho 5.30, Mississippi 5.31, West Virginia 5.44, Maine 5.44, also Colorado 5.54, Indiana 5.62, Oregon 5.65, Vermont 5.66, Wyoming 5.74, Ohio 6.09, Alaska 6.11, Utah 6.19. I know a lot of people will think, well, Corsair, Illinois, we're at 5 with only 4% of people who live in Illinois having serious thoughts of suicide. And you might say that's good. But a lot of people don't realize 4% of an entire group, or entire population is a lot of people, right? 388,000 people who live in Illinois experience thoughts of suicide or have serious thoughts of suicide. That is not good. That is not good. And a lot of people will say, well, Corsair, where do you expect that number to be? Zero. I expect that number to be at zero. And that's the big thing. But, I won't get on my soapbox about that. But yeah, that's really sad to see. Okay, let's go on to the next one. All right, so youth with at least one major depressive episode. All right, we're ranked number 22 with 15.15%. All right, so again, just like what we read before, I won't reread that. All right, so next one, childhood depression is more likely to persist into adulthood if gone untreated. Number of youth experiencing major depressive episode increased by 306,000 or 1.24% from last year's data set. The state prevalence of youth with MDE ranges from 11.36% in the District of Columbia to 18.60% in Oregon. Right, and yep, that does make sense. That does make 100% sense, right? If left untreated, childhood depression will carry on into adulthood. So this is a big reason why we need better access to mental health care, because we don't want that. One of the symptoms of major depression is thoughts of suicide. So if we take care of this, it's possible that the number we saw above will go down in regards to people having thoughts of suicide. All right, so let's see where we're at. We're at number 22 at 15.15, or 149,000 youth that live in Illinois experiencing a major depressive episode. All right, so the top 13, which we did not make, are District of Columbia with 11.36, Mississippi with a 12.64, New Jersey at 12.71, Pennsylvania at 12.88, Florida 13.25, New York 13.29, Tennessee 13.72, Georgia 13.75, South Carolina 13.82, Louisiana 14.14, Hawaii 14.16, Connecticut 14.41, and Alabama 14.51. And then let me go ahead and do that so you guys can see where your state is at. All right, now going down to number 35, or no, number 39, excuse me, West Virginia 16.62, North Carolina 16.68, Iowa 16.69, Oklahoma 17.01, Arizona 17.41, Idaho 17.44, Wyoming 17.59, Utah 17.77, Nevada 17.93, Alaska 17.93, Washington 18.22, New Mexico 18.6, and Oregon 18.62. Sad to see, it really is. No buts there. It is really sad to see. We, like I said, we need to get better care. All right, so next, youth with severe and major depressive episodes. All right, so 10.06 of youth, or over 2.5 million youth, cope with severe and major depression. The number of youth experiencing severe and major depression increased by 197,000 from last year's data set. The state prevalence of youth with severe MDE ranges from 7.3% in the District of Columbia to 14.8% in Wyoming. And that makes sense. That makes sense, especially with better access to technology, better access to social media, people getting judged consistently, especially our youth. Like I said, that makes sense to me. Along with bullying that's still going on, along with parents not being not just knowledgeable, but open and understanding to their mental health issues and things like that. That makes sense to me. All right, but let's go along to see where Illinois is. All right, again, ranked 24 with 11%, or 104,000 youth that are going on experiencing severe major depressive episode. All right, we didn't make the top 13, which is where we want to be. But number one, District of Columbia with 7.3%, 8%, Alabama 7.5, Connecticut 7.8, Mississippi 8, Pennsylvania 8.2, New York 8.3, Rhode Island 8.3, Hawaii 8.4, New Jersey 8.4, Colorado 9, Florida 9, Ohio 9, and Georgia 9.1. All right, and then I'll do this so that way you can see where your state is. Let me scroll down a little bit more. There we go. All right, now let's get into number 39. West Virginia at 13.3, Iowa at 13.5, Washington at 13.5, Maine at 13.6, Vermont 13.7, New Mexico 13.8, Oregon 14.1, North Carolina 14.2, Arkansas 14.3, Indiana 14.5, Utah 14.5, Idaho 14.7, Wyoming 14.8. And yeah, that is that. All right, so now let's go on to youth with substance use disorder. Let's see where we are. Ranked 27. Again, not the best. We want to be in the top 13. But that's where we're at. All right, so youth, or 4.08% of youth in the U.S. report having a substance use disorder in the past year. 16.4% had an alcohol use disorder in the past year, while 3.16% had an illicit drug use disorder. The state prevalence of youth with substance use disorder ranges from 3.19% in Alabama to 5.77% in Oregon. And again, we are at number 27 at 4.25%, or 42,000 youth in Illinois who have a substance use disorder. And I'm assuming youth, they mean either 17 and younger or 18 and younger. So, wow. Again, where do we want that to be? 0. But that's where we're at, unfortunately. All right, so now going into the top 13, which is where we want to be, but we're not. Alabama, 3.19%. Louisiana, 3.29%. Mississippi, 3.32%. New Jersey, 3.33%. Georgia 3.45, Texas 3.49, Pennsylvania 3.52, Arkansas 3.63, Maryland 3.7, Virginia 3.71, Connecticut 3.74, Hawaii 3.75, and Utah 3.77. All right, so I will scroll down so I can see where your state is ranked. Alrighty, now let's go down to number 39. Maine 4.67, Arizona 4.83, Washington 4.84, Iowa 5.07, North Dakota 5.08, Wyoming 5.22, New Mexico 5.43, Colorado 5.44, Vermont 5.5, District of Columbia 5.57, Nevada 5.59, Montana 5.68, and Oregon 5.77. All right, so that's where we are at. All right, excuse me. Next, students identify with an emotional disturbance for an individual education program, or IEP. All right, and where are we at? All right, we are ranked 14, so we just missed the top 13, which is where we want to be. All right, so let's take a look-see. All right, only 0.759% of students are identified as having an emotional disturbance for an individualized education program, or IEP. For purposes of an IEP, the term emotional disturbance is used to define youth with a mental illness that is affecting their abilities to succeed in school. All right, early identification for IEPs is critical. IEPs provide the service, accommodations, and support students with EDs need to receive quality education. The rate for this measure is shown as a rate per 1,000 students. Okay. The calculation was made this way for ease of reading. Unfortunately, doing so hides the fact that percentages are significantly lower. All right, so if states were doing a better job of identifying whether youth had emotional difficulties that could be better supported through an IEP, the rates would be closer to 8% instead of 0.8%. Wow. All right, so the state rate of students identified as having an emotional disturbance for an IEP ranges from 3.23 per 1,000 students in Vermont to 2.13 per 1,000 students in Alabama. So these numbers should be higher, right? These numbers should be higher then. Oh, well, I'll let you guys do the math yourself. Let's get in because I'm not good at math anymore. But let's get into the percentages. All right, let me pause right here real quick to take a look at that because I noticed that it just got a lot darker in here. All right, and we're back. All right, so I wanted to see if I needed to turn on the light, but my ring light is doing a perfectly great job in my little corner here, so I guess that won't be needed. All right, so let's see. We are at 10.59. Like I said, this number should be bigger. So I think this is actually, if you add a couple zeros, yeah, okay. So let's go into the top 13. Vermont at 3.23%, Minnesota at 2.1, or sorry, 20. Let me start over. All right, for Vermont at 32.23%, Minnesota at 21.20%, Massachusetts at 20.22%, Pennsylvania at 16.33%, Wisconsin 16.18%, Maine 15.32%, Indiana 13.36%, Iowa 13.31%, New Hampshire 13.24%, Connecticut 12.43%, Rhode Island at 12.34%, North Dakota 11.99%, District of Columbia 11.54%, and again, us at Illinois coming in at number 14. All right, so I will scroll down a little bit so you guys can see where your state is. All right, now let's go into 39 to 52. Washington at 5.49%, Florida at 5.43%, Idaho at 4.95%, Nevada 4.64%, California 4.51%, West Virginia 4.45%, Tennessee 3.84%, North Carolina 3.65%, Utah 3.12%, South Carolina 3.05%, Louisiana 2.74%, Arkansas 2.54%, and Alabama 2.13%. Alrighty. All right, and that's it for that one. All right, let's scroll back up because there are more. Sorry if you guys are fast forward through this part if you're getting a headache. Because now we got to get into some of the other tabs that are there. All right, so we did the prevalence of mental illness. Right, that's the prevalence data. All right, so now we go into some of the other ones. All right, so we have adult rankings. Let's just take a quick look, see what this is. All right, I think this is a little bit of some of the stuff we went over before. Yep, this looks like some of the stuff we went over before. Okay, it's just separated from adults and kids. All right, so I believe some of this other stuff we can take a look at over here. All right, so access to care. All right, access to care ranking 2022. All right, so access ranking indicates how much access to mental health care exists within a state. The access measures include access to insurance, access to treatment, quality and cost of insurance, access to special education, and workforce availability. A high access rating indicates that a state provides relatively more access to insurance and mental health treatment. Okay, so again, 1 to 13 is where we want to be. 39 to 51 is where we do not want to be. Well, anywhere under 13 really is where we do not want to be. But okay, let's take a look at it. All right, so we are right at the cusp. Oh, wow, 13. All right, so we are ranked 13. So yeah, that's good. We made the top 13, but like I said, we want to be number 1 here in Illinois. So wow. Okay, let's take a look-see. All right, so the top 13, Vermont, Massachusetts, Maine, Wisconsin, Minnesota, New Hampshire, Rhode Island, Pennsylvania, Connecticut, the District of Columbia, Washington, Montana, and Illinois. So if you're in any of those states, you have better access to mental health care. All right, and I will do this real quick so that we can see your state before we go down to number 39, which is Nevada. 40, Arkansas, Missouri, Idaho, South Carolina, Kansas, Tennessee, Arizona, Mississippi, Georgia, Florida, Alabama, and Texas. All right. So adults with any mental illness who are uninsured, we are number 14. So we did not crack the top 13, which is not good. But let's take a look-see. All right. So again, just like I illustrated in the prior one, 11.1% or over 5.5 million Americans or adults with a mental illness remain uninsured. The rankings for this indicator use data from the 2017-2018 NSDUH. In December 2017, Congress passed the Tax Cuts and Jobs Act, which eliminated the individual mandate penalty from the ACA. There was a 0.5% increase from last year's data set, the first time this indicator has increased since the passage of the ACA. And ACA Affordable Care Act, I'll talk about that in a little bit, but the increase in this indicator is consistent with data from the U.S. Census Bureau, which found that in 2018, the rate of uninsured Americans rose for the first time since the ACA took effect. Only 20 states saw a reduction in adults with AMI who are uninsured in this year's data set. The largest reductions were seen in Louisiana, South Dakota, Kentucky, and Kansas. The largest increases were seen in Iowa, Mississippi, Arkansas, and Missouri. The state prevalence of uninsured adults with mental illness ranges from 3.8% in Massachusetts to 21.5% in Texas. All right, so with the AMA, a lot of people either loved it or hate it, right? Did I say AMA? I meant ACA, or the Affordable Care Act. Because ultimately what happened with that, and people can agree or disagree with me on this, that's 100% their right to do so. You were practically forced to get insurance, right? If you chose not to get insurance, you can pay the penalty and opt to not have insurance, right? And what that did is it made insurance more affordable to people, depending on where you're at in I forgot what it's specifically called, but ultimately, or in the network or the marketplace, right there you go, the insurance marketplace, you had deals or plans that were affordable and accessible. And with that, a lot of people had more access to healthcare. Well, and then I forgot when in Illinois, when Rauner was governor, right, he cut funds for mental health. And that also affected insurances as well, which I could see probably why we're at number 14 on this, but I have to go back to that specific year to see. Though, ultimately, now with them taking that penalty out, and people are like, okay, I don't really need insurance, so I'm not going to take it, that made insurances more expensive, right? And depending on whether you have public or private insurance, right, it just made it more expensive. So, without going on to a whole tangent on that, or basically showing you guys the legislative, why am I thinking about transcripts? Sorry, the legislative, or the legislation. I don't even want to say legislative, but without showing you guys the legislation, things like that, this makes sense, at least to me. All right, so now let's go over the rankings. Like I said, we did not make the top 13. We were number 14 at 7.1%, or 130,000 Americans live in Illinois are uninsured with any mental illness. All right, the top 13, Massachusetts with 3.8, Kentucky with 4.2, Rhode Island 4.4, District of Columbia 4.7, Hawaii 4.7, Vermont with 5.1, New York with 5.2, Connecticut with 5.4, Maryland with 5.6, Pennsylvania 5.9, Wisconsin with 6.3, Michigan with 6.9, and Ohio with 6.9. All right, I'm going to scroll down so that way you can see your state. All right, now we'll get into 39 to 52. I, Idaho with 14%, Kansas with 14%, Georgia 15.2%, Tennessee with 15.3%, North Carolina 15.4%, South Carolina 15.6%, Oklahoma 17.6%, Florida 17.8%, Wyoming with 18%, Mississippi with 18.2%, Alabama 19.3%, Missouri with 19.3%, Texas with 21.5%. And yeah, okay, and again, adults with any mental illness who did not receive treatment in 2022. So that is, we are ranked 20. Okay, we are ranked 20. All right, so let's take a look see at that. All right, so over half, 56% of adults with a mental illness received no treatment. Over 27 million individuals experiencing a mental illness are going untreated. The state prevalence of untreated adults with mental illness ranges from 4.26% in Vermont to 67.1% in Hawaii. All right, and then we are at number 20 with 52.6% of adults living in Illinois, or 958,000 adults living in Illinois did not receive treatment for their mental illness. And like I said, there's a bunch of factors that can go into that, whether it's financial, limits in insurance, limits with, not IEPs, I'm thinking about IEPs, sorry, EAPs when it comes to jobs, the stigma behind it, so on and so forth. I can go on with that list, but let's take a look and see the top 13. So we got Vermont at 42.6, Iowa at 44.2, Massachusetts 44.7, Wisconsin 44.8, Minnesota 46.1, Maine 47.7, Nebraska 48.8, Arkansas 49.6, Utah 49.7, North Dakota 50.1, Ohio 50.3, Rhode Island with 51, and Montana with 51. All right, and then let me scroll down so you can see your state. Oops, there we go. All right, now getting into 39, Alabama 57.3, Maryland 58, Nevada 58, New York 58.3, Alaska 58.7, Mississippi 59.3, Louisiana 59.6, Texas 60.7, Wyoming 61.7, California 61.8, Florida 63.5, Georgia 63.5, and Hawaii 67.1. But wow, that is a lot of people. A lot of people, right? All right, so adults with any mental illness reporting unmet needs. We are ranked 16. All right, we are not the top 13, so yep, we got to do better with that. Again, almost a quarter, 24.7% of all adults with a mental illness reported that they were not able to receive the treatment they needed. This number has not declined since 2011. All right, so individuals seeking treatment but still not receiving needed services face the same barriers that contribute to the number of individuals not receiving treatment. All right, and then it goes with no insurance or limited coverage of services, something I talked about a little bit already, shortfalls in psychiatrists, and an overall undersized mental health workforce. Interesting. Lack of available treatment types and patient treatment, individual therapy, intensive community services. All right, that makes sense to me. Disconnect between primary care systems and behavioral health systems. Yep, that's a big one. That is a huge, huge one. Insufficient finances to cover costs, including copays, uncovered treatment types, or when providers do not take insurance. Yep, that is big too. That is big. That is really big. All right, the state prevalence of adults with AMI reporting unmet treatment needs ranges from 4.9% in Hawaii to 37.1% in the District of Columbia. Well, I'm not going to get on my soapbox here or go on a tangent with that, but a lot of these definitely resonate in Illinois. So that makes sense why we are ranked 16. True, we're doing better than others, but we could be doing so much more better. We could be. But yeah, I won't get on my tangent about that. Actually, let me just mention a couple of things real quick. All right, so limited coverages of services, that is something that, of course, the Illinois Counselor Association, MCA, the Illinois Mental Health Counselor Association, as well as ACA, the American Counselor Association, as well as other groups and organizations, they're fighting to really get rid of, because ultimately we do not want to limit people in regards to coverages of services. Yeah, we do not. We do not. And that's something big that really hinders people from getting services in the first place, because if they're not going to be able to continue with it, then what's the point in starting it in the first place? And then also lack of available treatment types. This is big too, right? Inpatient facility stuff, just going straight to the hospital. They can go to an inpatient facility where they spend a certain amount of time, get better, get stable on medication, go back out in the community while continuing their care to outpatient, right? There are not a lot of inpatient communities, which causes people, especially here in Illinois, to travel long and far to essentially get that. And that's big. That is big. We need more inpatient treatment facilities that are not hospitals, so that way people have better access to care. And then also, like I said, this is big disconnect between primary care service and behavioral health systems, right? A lot of people fall through the cracks, which is sad to say. And yes, we can be doing better at making sure those people do not fall through the cracks, of making sure releases of information continue to get updated, coordination of care continues even after the patient has been successfully transferred to somewhere else, and things like that. And the last one, insufficient finances to cover costs, including copays, and cover treatment types when providers do not take insurance. And that is big right here, because ultimately, especially with people in private practices or people who are in non-for-profit organizations, not everybody, but there are people who run their private practice like a business model. In a business model, right, you either want to get paid, right, for profit. And a lot of people do their best to provide a sliding scale fee, depending on what's the word I'm looking for, level of pay that they're receiving from their job, and also with other factors. Some might do number of dependents, some might do cost of living, some might do, other things to try to help outset that. But that makes sense, right? We need to get paid, right? We need to make a living. We need to put food on our table. We need to eat, right? We need to make sure that we ourselves are taken care of. So that makes sense to me why, if your insurance doesn't cover it, you'd be liable for that, especially if you make above a certain amount, then you'd be liable for the full amount if you don't cover, or you don't cover. So if you don't qualify for the sliding scale, right? Like I said, that makes sense to me. I can go on a tangent about that, but I won't. So let's continue. All right, so we are number 16 with 23.2%, or 422,000 Americans that live in Illinois who have unmet needs. All right, so let's take a look, see. For the top 13, Hawaii with 14.9%, Louisiana with 18.4%, South Carolina with 19.7%, Montana with 21.5%, Minnesota with 21.6%, New Jersey with 21.6%, Massachusetts with 21.7%, New York with 21.7%, West Virginia with 22.2%, Florida with 22.4%, New Hampshire with 22.4%, New Mexico with 22.7%, Kentucky with 22.9%, and that is the top 13. So I'll go ahead and pause right here for a little bit, so that way you can actually see where your state is. All right, now let's go to 39. Virginia with 27.7%, Utah with 27.9%, Delaware with 28.1%, Arizona with 28.4%, Oregon with 28.8%, Idaho with 29.1%, Nevada with 29.3%, Missouri with 30.1%, Maryland with 30.2%, Colorado with 31.8%, Kansas with 32.6%, Iowa with 32.9%, and the District of Columbia with 37.1%. Right? And again, over 12 million adults with unmet needs. That is a lot. All right, next we go into adults with disability who could not see a doctor due to costs in 2022. Where does Illinois rank? We rank, ooh, 42 with 32.25%. All right, so 29.67% of adults with a cognitive disability were not able to see a doctor due to costs. According to the Center of Disease Control, 12% of people in the U.S. had a cognitive disability, even when adjusted for age. The percentage of people with cognitive disability ranged from 8.9% in some states to 19.6%. The prevalence of adults with cognitive disability who could see a MD or a medical doctor due to cost range from 18.48% in Rhode Island to 40.65% in Texas. And again, we are down a bit. We are down a bit. We're at 40. We're at rank 42, which is not good. That is bad, really bad. At 32.25% or 306,123 Americans or adults who live in Illinois, right, with a disability who cannot see a doctor due to costs. Right, and that could be for multiple different factors I stated above, so I won't get back into that. But let's go into the 13. Right, so number 1 is Rhode Island, with 18.48. Number 2 is Vermont, 20.33. Connecticut, 20.59. Iowa, 21.22. Massachusetts, 21.68. North Dakota, 22.25. Wisconsin, 22.28. Hawaii, 22.9. Kentucky, 23.34. West Virginia, 23.35. Washington, 23.45. Montana, 23.68. Pennsylvania, 23.77. Maryland, 23.87. Nevada, 24.31. New York, 24.53. I went past 13. But yeah, Pennsylvania's number 13, 23.77. Let me scroll down so you guys can see your state. Alrighty, now let's get into number 39. Arizona, 31.35. Oklahoma, 31.52. South Carolina, 31.7. Illinois, 32.25. North Carolina, 32.94. Wyoming, 32.94. Utah, 33.31. Mississippi, 33.37. Florida, 34.9. Alabama, 38.35. Kansas, 38.74. Georgia, 39.18. And Texas, 40.65. All right, now we get into youth with major depressive episode who did not receive mental health services in 2022. We are ranked number 20. Not good. Not good at all. With 55.2%, so over half of our youth. Wow. Okay. 60.3% of youth with major depression do not receive any mental health treatment. Youth experiencing MDE continue to go untreated. Even among the states with greatest access for youth, 1 in 3 youth are still not receiving the mental health services they need. The state prevalence of untreated youth with depression ranges from 30% in Maine to 73.1% in Texas. Wow. All right, and we are at 20, 55.2%, which is 77,000 youth. Yep, we definitely need to do better. All right, so number 1 is Maine at 30%, Colorado at 39.3%, District of Columbia 41%, Vermont 42.6%, Maryland 44.7%, Wyoming at 44.9%, Utah 45.4%, New Hampshire 46.6%, Iowa at 49.3%, Oregon at 49.7%, Washington at 49.8%, Indiana at 51.5%, North Carolina at 51.9%. Alrighty, I will put it here so that way you guys can see your state. Alrighty, let's go down to number 39, which is Rhode Island at 64.9%, Nevada at 65.2%, Connecticut at 65.6%, Tennessee at 66.5%, Alabama at 66.8%, Idaho at 67.1%, Florida at 67.3%, South Carolina 67.6, Georgia 67.8, Arizona at 70.1, Hawaii 71, Mississippi 71.7, Texas at 73.1. All right, and then youth with severe MDE who received some consistent treatment in 2022, we are ranked 8. All right, not the best, but still we're in the top 13, which is good. All right, so these are youth with severe MDE who received some consistent treatment in 2022. Nationally, only 27.2% of youth with severe depression receive some consistent treatment, 7 to 25 plus visits in a year. I'm sorry, 7 to 25 plus visits in a year. Well, if there are 52 weeks in a year, well, I really, okay. Before I go on a tangent with that, let me just continue. All right, so even when simply measuring the number of visits, fewer than 1 in 3 youth with severe depression meet this determination of consistent care. The state prevalence of youth with severe depression who receive some outpatient treatment ranges from 65.6% in Maine to 12.2% in Tennessee. High percentages are associated with positive outcomes, and low percentages are associated with poor outcomes. Okay. All right, so here higher percentages associated with positive outcomes, lower with poor outcomes. Okay. Again, we are number 8 at 38.3% or 38,000 youth. Okay, so number 1 is Maine at 65.6, Vermont at 49.7, New Hampshire 47.6, Wyoming 45.6, Colorado 43.1, Massachusetts 42.2, Pennsylvania 39.9, Illinois 38.3, Oregon 36.6, Wisconsin 36.4, Delaware 36.3, Minnesota 35.9, and District of Columbia 35.8. Right, and I'll scroll down so that way, give you guys a second to take a look at your state. All right, now let's go to Louisiana at 21.1, West Virginia at 20.9, Rhode Island at 20.4, Alaska at 20.2, Georgia at 20.1, Texas is 19.2, Nevada 18.7, Florida at 17, Arizona at 16.1, Mississippi 13.5, Hawaii at 13.3, Missouri at 12.6, Tennessee at 12.2. So those are youth who receive consistent care. Sad to see, really sad to see. All right, but next, children with private insurance that did not cover mental or emotional problems. So I'm assuming we're ranked 19 or 6.6%. All right, so mental health, parity, and addictions equity law was enacted in 2008 and promised the equal coverage of mental health and substance use services. However, the rate of children with private insurance that does not cover mental or emotional problems increased 0.3% from last year's data set, and there are still 950,000 youth without coverage for their behavioral health. The state prevalence of children lacking mental health coverage ranges from 1.9% in Massachusetts to 17.7% in Arkansas. Like I said, we are at 6.6% or 33,000 youth in Illinois with private insurance that did not cover mental or emotional problems. All right, so number 1 is Massachusetts at 1.9, Vermont at 2.1, Connecticut at 3.5, Rhode Island at 3.8, Missouri at 4.2, New Hampshire at 4.3, Oklahoma at 4.4, District of Columbia at 4.5, West Virginia at 4.5, Wisconsin at 4.5, South Dakota at 4.7, Utah at 4.7, and New Jersey at 5. And that is the top 13 states. All right, and then I will go ahead and scroll down so that way you guys can see your state. All right, then we get to 39, which is Montana at 9.5, Colorado at 9.6, North Carolina at 10, Arizona at 10.2, Florida at 11.7, Idaho at 12.2, South Carolina at 12.4, Alabama at 12.5, Wyoming at 12.7, Texas at 13.8, Nebraska at 15.4, North Dakota at 15.6, and Arkansas at 17.7. Again, that's 39 to 51. All right, so next we get into students identified with an emotional disturbance for an individualized education program. I think we might have went over this already, but I'll go over it again. In Illinois, we're ranked number 14, so we just missed the 13. So that's not good. Again, better than a lot of other states, but still, we could be doing a lot better. All right, so yep, we read the first part. Yeah, we read that part. Yep. Okay, so yeah, we did this one already. So I'll go ahead and just scroll past this. Okay, mental health workforce availability. So we are ranked 28, 410 to 1. Wow. Wow, wow, wow. Okay. In term, mental health provider includes psychiatrists, psychologists, licensed clinical social workers, counselors, marriage and family therapists, and nurses, advanced practice nurse specialized in mental health care. The rate of mental health providers has improved in nearly every state since last year's report, so that's good. All right, and the state rate of mental health workforce ranges from 150 to 1 in Massachusetts and 920 to 1 in Alabama. So what that is, I'm assuming, or I believe, which I'm pretty sure it is, 150 residents in that state to every one mental health professional. All right, and we are, just like what we saw up top, number 28. So for every one mental health professional, there are 410 people. Okay, so then the top 13, Massachusetts at 150 to 1, Oregon 180 to 1, District of Columbia 190 to 1, Alaska 200 to 1, Maine 200 to 1, Vermont 210 to 1, Connecticut 240 to 1, Oklahoma 240 to 1, Rhode Island 240 to 1, New Mexico 250 to 1, Washington 250 to 1, California 270 to 1, Colorado 270 to 1, Utah 290 to 1, Wyoming 290 to 1, New Hampshire 310 to 1, Montana 320 to 1, Louisiana 330 to 1, New York 330 to 1. Oh, sorry. Went past Colorado, which is number 13. So let me just go ahead and scroll down so you can see your state. All right, and let's get into number 39. South Dakota 530 to 1, Virginia 530 to 1, South Carolina 550 to 1, Florida 590 to 1, Indiana 590 to 1, Mississippi 590 to 1, Iowa 610 to 1, Tennessee 630 to 1, Georgia 690 to 1, Arizona 710 to 1, West Virginia 730 to 1, Texas 830 to 1, and Alabama 920 to 1. And I guess for Illinois, it kind of makes sense, at least from where I live, or the region of Illinois where I live. You get told a lot that you don't go into it for the money, right? Which is true, right? We don't go into it for the money. We go in to tell people. But you have a lot of people saying that you're not going to make a lot of money. You're going to be poor. You're going to essentially not be able to take care of yourself. You're going to need to work a second or a third job, right? So on and so forth. But like I said, it just depends on who wants to actually go into the field and ultimately who wants to help people with their mental health. All right, and that's that for that. All right, so what we will do before we go into final thoughts, let me just scroll back up real quick to 2022. All right, and then let's go into ranking states guideline. Oh, no, we did that already. Ranking the states. Yep, we did that already. Prevalence, access to care view all data. All right, here we go. So we'll just go into Illinois for 2022. Apply. All right, so here we go. Just the numbers that we took a look at already. We're ranked number 5 in adult suicidal ideation, number 10 in overall adult ranking, number 11. All right, I won't read this. I'll just slowly scroll down so that way you guys can see. But yeah, a few of these numbers didn't surprise me, and then a few of these numbers did surprise me. But ultimately, at the end of it all, it makes sense. It makes sense. And yeah, I'll get into that. Oops, didn't mean to do that. Ooh, okay, there we go. I'm just gonna scroll back up. Let's take a look at the glossary. All right, indicator. Okay, so this is their sources that they got. All right, so if you want to take a look at sources, it sounds like there's a lot. Samsung, CDC, county health rankings. Ooh, road maps. I gotta make a note of that later. It's like for my own personal research, but yeah, a lot of SAMHSA. All right, so now let's go into final thoughts. So, final thoughts. Some of those numbers I was not surprised to see, especially when it comes to the United States or to Illinois specifically. Some of those other numbers, though, as you can see through my facial expression, surprised me. So ultimately, yeah, we could be doing better. We could be doing a lot better. But that will have to come with more time, work, patience, especially when we go into 2022. So going into 2022, let's just remember that we need to take care of ourselves. Mental health is just as important as physical health. All right, so let's remember, some common things to do. First things first, we need to make sure we're getting our 6 to 8 hours of sleep a day. Right? We need to have a set bedtime, a set wake up time despite things that are going on in our life. Right? We need to make sure that we are staying active. No, I'm not saying that we need to, what's the better word for it? We need to go to the gym, 2 or 3 times a day, 2 or 3 times a week, not 2 or 3 times a day, or anything like that. But we need to stay active. We need to keep moving. We need to stay connected with people, right? Whether that is in person or virtual, depending on what 2022 may bring. But ultimately, the main thing to remember is that, and I know I said this before, but we need to take care of ourselves, right? Going off of the airplane analogy, we have to put the gas mask on ourselves first, or the oxygen mask, depending on what you decide to call it. We have to put that on ourselves first before we could put it on anybody else. So that's something that we need to remember. All right, other than that, do your best if you're looking to make Illinois better in regards to mental health. Write your legislator, get in contact with different organizations like the Illinois Mental Health Council Association, the ICA, the ACA, the American Psychology Association, ASW, American Association for Social Work, I believe it's called. I'm not 100% sure. Right? And also get people to do research, take a look at things that can help them out with their mental health. But ultimately, I'm going to stop there and say, thank you guys very much for watching. And let's take care of ourselves going into 2022. Have a great rest of your day.